Welcome to the deep dive.
Yeah.
This time we're going to examine a pretty unique case study
Okay.
of an 18-year-old American saddlebred mare. And she had a confusing mix of neurological symptoms and ultimately a very surprising diagnosis.
Interesting.
And you've provided us with a research article detailing this case.
Yes.
And so we're going to unpack what makes this case so unusual.
Okay.
We're going to focus on the clinical presentation,
Yeah.
diagnostic challenges, and the ultimate cause.
Right.
Acute myeloid leukemia
Yeah.
with a neurological component.
That's right. It certainly is a fascinating case. And for this deep dive, we'll focus on the clinical presentation of the mare, the diagnostic challenges that the veterinary team faced, and like you said, the ultimate cause of acute myeloid leukemia with this unexpected neurological component.
Okay, so let's start with the mare's initial presentation.
Sure.
So the study describes fever, ataxia, and difficulty eating.
Right.
And she was also in generally poor condition.
Yes. Based on those signs, the veterinarians initially suspected a primary neurological disease.
Okay, so what were some of their initial thoughts?
Well, the usual suspects in these cases are things like Equine alphaherpesvirus 1, West Nile Virus, Eastern equine encephalitis virus, and even tetanus.
And the study mentions that financial constraints limited the diagnostic workup.
It did.
So how did that impact the process?
Absolutely. So it made it much more challenging to pinpoint the diagnosis.
Okay.
The limited blood work that was available, which included PCV, total protein, and a point-of-care blood gas analysis, didn't really offer a clear answer.
Okay, so then what happened?
Well, this is where it gets really interesting.
Okay.
So the postmortem examination is really where the mystery started to unravel.
Okay.
So the veterinary team found widespread hemorrhages in the brain, which, you know, is consistent with some of those neurological signs that the mare was showing when she was alive.
Yeah.
They also found some unusual lesions in the small intestines. Oh, interesting.
Multiple yellowish ulcerated plaques throughout the intestinal mucosa.
The study also mentions atypical cells in the hemorrhages and blood vessels.
Yes, that's right.
Can you tell us more about that?
So under the microscope, these cells appeared kind of blast-like.
Okay.
So that means they resemble immature blood cells. And this finding prompted further investigation using immunohistochemistry.
Okay.
And this technique uses antibodies to identify specific proteins in cells.
And what did the immunohistochemistry reveal?
Well, it revealed that these blast-like cells expressed both IBA1 and MPO, indicating a myeloid origin.
IBA1 and MPO. Can you explain the significance of these markers?
Sure. So IBA1 is a marker often used to identify macrophages, which are cells involved in the immune response. And then MPO is an enzyme found in certain white blood cells, specifically those of the myeloid lineage. So the fact that these atypical cells expressed both IBA1 and MPO strongly suggested a myeloid leukemia. It sounds like the discovery of these cells was a real turning point in the investigation.
It was.
So what did they find when they examined the bone marrow?
Well, the bone marrow examination really solidified the diagnosis. It was almost entirely replaced by similar neoplastic cells.
Wow.
Confirming acute myeloid leukemia.
Based on those findings, how did they classify this specific type of leukemia?
So they classified it as AML-M1, meaning acute myeloid leukemia without maturation. And that's according to the WHO criteria. And this classification, you know, considers the morphology and the characteristics of the leukemia cells.
So were they able to rule out those initial suspicions of other neurological diseases?
They were. Tests for rabies, Eastern equine encephalitis virus, West Nile virus, and Clostridial toxins all came back negative.
But what about those lesions in the small intestine? Did they culture any bacteria from those?
They did. They cultured several bacteria, including bacteroids, Clostridium, E. coli, and Streptococcus from both the small intestine and the lungs. However, determining whether these infections were primary or secondary to the leukemia is difficult.
So it's possible that the leukemia could weaken the mare's immune system.
It is.
Making her more susceptible to infection.
That's certainly a possibility.
Okay, so let's get back to those unusual neurological signs for a moment. It's not typical for acute myeloid leukemia to present this way in horses, is it?
That's the burning question. Why the neurological symptoms? Why the hemorrhages in the brain? You know, there are a few potential explanations.
Okay.
One possibility is that the leukemic cells themselves contributed to the bleeding.
Okay.
Remember those blast-like cells that were found within the hemorrhages and blood vessels? So their presence suggests that they might be obstructing blood flow, leading to the hemorrhages.
So could something else be contributing to the bleeding in the brain?
Well, thrombocytopenia, which is a low platelet count, is another possibility. So platelets are essential for blood clotting. So a deficiency can increase bleeding.
Right.
And the absence of megakaryocytes in the bone marrow, which are the cells that produce platelets, supports this theory.
So the leukemia could have been interfering with platelet production, leading to the hemorrhages. Okay. Another possibility the study mentions is disseminated intravascular coagulation.
Right, or DIC.
DIC, okay.
So this is a serious condition in which the body's clotting mechanisms basically malfunction, leading to both excessive clotting and bleeding.
DIC sounds very serious.
It is.
Is it associated with acute myeloid leukemia?
It is. DIC is a known complication of AML.
Okay.
And the presence of those blast-like cells in the blood vessels suggests they may be obstructing blood flow.
Okay.
Further contributing to the hemorrhages and potentially DIC.
So the leukemia itself might be directly impacting the brain.
It might.
In multiple ways. Are there any other factors that could explain the neurological symptoms?
There's one more factor to consider, and that's hyperleukocytosis.
Okay.
So this is a condition characterized by an extremely high number of white blood cells in the blood, often associated with AML. And hyperleukocytosis can lead to leukostasis.
What exactly is leukostasis, and how might it have contributed to the mare's neurological symptoms?
So in leukostasis, the high number of white blood cells can clog the blood vessels, reducing blood flow to vital organs, including the brain. And this can lead to various neurological complications. Leukostasis is a known cause of neurological problems in human AML patients. So it's certainly possible it played a role in this case as well.
That makes sense. It sounds like this case highlights a potentially dangerous link.
It does.
Between AML and neurological issues, even in horses.
Yes, and it raises a lot of important questions. For instance, how often is leukemia overlooked in cases presenting with unusual neurological signs?
That is the crux of the matter.
Right.
If veterinarians aren't looking for it, they might miss it.
Exactly.
Especially when financial constraints limit the diagnostic workup.
Right. This case emphasizes the need for awareness of the potential for leukemia to present atypically. Especially when a full workup isn't possible.
Speaking of limitations, the study authors mentioned a few.
They did.
They acknowledged that not having a full CBC and bone marrow cytology limited their ability to fully characterize the leukemia.
Yes. Those tests would have provided a more comprehensive understanding of the blood cell abnormalities. However, even with those limitations, this case study is a powerful reminder that leukemia should be considered, even in cases with predominantly neurological signs.
This study also mentions a significant percentage of hematologic malignancies in humans are diagnosed post-mortem.
That's right.
Does this suggest we might be missing cases in veterinary medicine as well?
That's certainly a possibility.
Okay.
The study authors propose that the rapid progression of the disease and the non-specific clinical signs in horses could lead to underdiagnosis of acute leukemia. By the time the disease is suspected, it might be too late.
That's a sobering thought.
It is.
It highlights the importance of thorough investigation, including post-mortem examinations.
Absolutely.
Guys,
we need to be detectives. Constantly searching for clues and considering all possibilities.
This case definitely makes you think twice about seemingly straightforward cases.
It certainly does. It reinforces the importance of staying curious, questioning assumptions, and continuously expanding our understanding of equine medicine.
Because even the rarest presentations can teach us valuable lessons.
Exactly, and that's why we keep diving deep, exploring the complexities and mysteries of the equine world.
It's a journey of endless discovery.
It truly is. Now let's look at Table 1 from the study, which presents the results of the mare's blood work. While limited, there are some interesting findings here. The PCV and total solids were within normal limits. But the blood gas analysis revealed some abnormalities.
What kind of abnormality?
The blood gas analysis showed that the mare was acidemic, with a low pH and a high PCO2. This indicates a respiratory acidosis. The study authors suggested that this might be due to the pneumonia that was found at necropsy.
Okay, the blood gas analysis also showed that the mare had a high anion gap.
Right.
What does that indicate?
So the anion gap is a calculation that helps to determine the cause of metabolic acidosis. A high anion gap suggests that the acidosis is caused by an accumulation of unmeasured anions in the blood, such as lactate or ketones.
The mare also had hyperlactatemia. Is this finding consistent with the high anion gap metabolic acidosis?
Absolutely. Hyperlactatemia.
Okay.
An elevated blood lactate level is a common cause of high anion gap metabolic acidosis.
Okay.
Lactate buildup can occur when tissues are not receiving enough oxygen.
Okay.
A condition known as tissue hypoxia.
The study mentions several potential causes of tissue hypoxia in this case.
It does.
They list poor perfusion due to the hemorrhages, anemia, and sepsis.
Yeah.
Do you think those are all possibilities?
Yes, I think all of those are potential contributors to the hyperlactatemia in this case.
Okay.
The hemorrhages could have led to decreased blood flow and oxygen delivery to the tissues.
Right.
Anemia, a decrease in the number of red blood cells, also reduces the oxygen carrying capacity of the blood. And sepsis, a systemic inflammatory response to infection, can lead to tissue hypoxia through a variety of mechanisms.
Looking at Figure 1, we see representative images from the mare's histopathology.
Right.
Could you describe some of the key findings presented in this figure?
Certainly. Figure 1A shows a section of the cerebrum with a large hemorrhage.
Okay.
Within the hemorrhage, we can see numerous blast-like cells with large, round nuclei and scant cytoplasm.
Okay.
These cells are consistent with the neoplastic cells found in the bone marrow, supporting the diagnosis of acute myeloid leukemia.
Figure 1B shows a section of the lungs.
Right.
What are some of the key findings in this image?
Figure 1B demonstrates a severe diffuse bronchopneumonia.
Okay.
The alveoli are filled with neutrophils, macrophages, and fibrin. This finding supports the clinical diagnosis of pneumonia, which likely contributed to the respiratory acidosis observed on blood gas analysis.
Figure 1C shows a section of the small intestine.
Yes.
Can you describe the findings in this image?
This image shows a section of the small intestine with a large area of necrosis and inflammation.
Okay.
This finding is consistent with the necrotizing enterocolitis found at necropsy. The study authors propose that the leukemic cells might have invaded the intestinal wall, leading to the necrosis and inflammation.
These images certainly paint a vivid picture of the extent of the disease in this mare.
They do.
Is there anything else notable in Figure 1?
Figure 1D shows a section of the bone marrow.
Well,
this image highlights the near-complete replacement of normal bone marrow elements with neoplastic cells.
Wow.
Again, consistent with the diagnosis of acute myeloid leukemia.
This deep dive has certainly been an eye-opener.
It has been, and it reminds us that even in the face of uncertainty, there's always something to be learned.
This case study certainly makes you think twice about seemingly straightforward cases, doesn't it?
It certainly does. It reinforces the importance of staying curious, questioning assumptions, and continuously expanding our understanding of equine medicine.
Because even the rarest presentations can teach us valuable lessons.
Exactly, and that's why we keep diving deep, exploring the complexities and mysteries of the equine world. It's a journey of endless discovery.
It truly is. Now, moving on to Figure 2. We see images of immunohistochemistry, staining of various tissues.
Right.
What is the significance of these images?
Figure 2 showcases the results of immunohistochemistry staining, a powerful tool that helps visualize specific proteins within cells.
Yeah.
These images provide further evidence supporting the diagnosis of acute myeloid leukemia and offer insight into the origin of the atypical cells.
What can you tell us about the staining patterns observed in Figure 2?
So Figure 2A demonstrates strong positive staining for IBA1 in the cytoplasm of the atypical cells found in the cerebrum. This finding indicates that these cells have a myeloid origin, meaning they're derived from a type of bone marrow stem cell that gives rise to several types of blood cells, including monocytes, macrophages, and some white blood cells.
Figure 2B also shows positive staining.
Yes.
This time for myeloperoxidase, or MPO.
Yes.
What does this tell us about the atypical cells?
So the strong positive staining for MPO in the cytoplasm of the atypical cells in the lung further supports a myeloid origin. MPO is an enzyme found primarily in neutrophils and monocytes, further reinforcing the connection to a myeloid lineage.
These immunohistochemistry findings, combined with the histopathology and bone marrow examination, provide compelling evidence for a diagnosis of acute myeloid leukemia.
They do.
What can we learn from these findings, and how might they impact future cases?
That's the crux of the matter.
Yeah.
These findings underscore the importance of considering acute myeloid leukemia as a differential diagnosis, even when the clinical presentation is unusual or dominated by neurological signs.
This case also highlights the value of advanced diagnostic techniques like immunohistochemistry in complex cases.
Yes. This case demonstrates how immunohistochemistry can help to identify the lineage of atypical cells, providing crucial information for diagnosis and potentially guiding treatment decisions in future cases.
So what can we take away from this deep dive into a rare case of acute myeloid leukemia with neurological manifestations?
This case reminds us that even common diseases can present in unexpected ways. It underscores the importance of a thorough investigation, including a detailed postmortem examination, which can be crucial for reaching a definitive diagnosis. This case emphasizes the potential for leukemia to manifest with neurological symptoms, a presentation not typically seen in horses.
This deep dive has been truly enlightening.
It has been, and it reminds us that even in the face of difficult cases, there's always hope for progress.
Hope fueled by knowledge, curiosity, and a dedication to equine well-being.
Beautifully said, and that's why we keep striving to learn, to grow, and to share our insights with others.
So that together we can make a difference in the lives of these magnificent animals.
Absolutely. From Vet NeuroJar. Keep those minds inspired, hearts light, and tails wagging.
All right, and we'll be back
Sounds
for part 2 of this deep dive into this very interesting case of acute myeloid leukemia in a horse.
Looking forward to it.
All right, we'll see you then.
See ya. It also raises the question of how often leukemia might be overlooked in horses presenting with neurological signs.
That's a good point if veterinarians aren't looking for it.
Exactly.
They might miss it.
That's right.
Especially in cases like this where there are financial constraints limiting the diagnostic workup.
Right, and this case underscores the need for awareness.
Yeah.
You know, for vets to be thinking about this as a possibility.
Right.
Leukemia. Even when the initial presentation seems to be pointing elsewhere.
It's like solving a puzzle. And the pieces don't fit the picture you initially expected.
And sometimes the most unexpected pieces hold the key to the solution. So this case serves as a reminder that we should always be open to, revising our initial assumptions and exploring less common possibilities.
Especially when dealing with complex and atypical presentations.
Absolutely. This case highlights the need for a comprehensive approach to diagnosis, considering the patient's entire clinical picture and not just focusing on the most obvious symptoms.
And it also emphasizes the value of collaboration and communication.
It does.
Within the veterinary community. So sharing these unusual cases and learning from each other's experiences can help to improve diagnostic accuracy and patient outcomes.
That's a great point. This case study serves as a valuable contribution to the collective knowledge base in equine medicine. By sharing these findings, the authors are encouraging ongoing research and discussion, ultimately leading to a better understanding of this complex disease.
This deep dive has been incredibly insightful.
It has.
It has broadened my understanding of acute myeloid leukemia and its potential to manifest in unexpected ways.
It has been a fascinating exploration of a rare and intriguing case.
That has.
And it reminds us that there's always more to learn, more to discover, and more ways to improve our approach to equine health.
It's a journey of continuous learning and discovery.
Absolutely. From Vet NeuroJar. Keep those minds-inspired hearts light and tails wagging. It also raises the question of how often leukemia might be overlooked in horses presenting with neurological signs.
That's a really good point.
This case underscores the need for heightened awareness among veterinary professionals. We need to be more vigilant in considering leukemia as a possible cause, even when the initial presentation seems to point elsewhere.
It's like having a puzzle where the pieces don't quite fit the picture you initially expected.
Exactly, and sometimes those most unexpected pieces hold the key to the solution. This case serves as a reminder that we should always be open to revising our initial assumptions and exploring less common possibilities.
Especially when dealing with complex and atypical presentations.
Absolutely. This case highlights the need for a comprehensive approach to diagnosis, considering the patient's entire clinical picture, not just focusing on the most obvious symptoms.
And it also emphasizes the value of collaboration and communication.
It does.
Within the veterinary community.
It does.
Sharing these unusual cases.
Yes.
And learning from each other's experiences can help improve diagnostic accuracy and patient outcomes.
That's a great point.
Yeah.
This case study serves as a valuable contribution to the collective knowledge base in equine medicine.
And by sharing these findings, the authors are encouraging ongoing research and a discussion, ultimately leading to a better understanding of this complex disease.
Absolutely.
This deep dive has been incredibly insightful.
It has been.
It's broadened my understanding of acute myeloid leukemia.
Good.
And its potential to manifest in these unexpected ways.
It has been a fascinating exploration of a rare and intriguing case.
It has.
And it reminds us that there's always more to learn, more to discover, and more ways to improve our approach to equine health.
It's a journey.
It is.
Of continuous learning and discovery.
Absolutely. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.